Trigeminal nerve. Trigeminal nerve is a fifth cranial nerve. It has four main nuclei. These nuclei are main sensory nucleus, spinal nucleus, mesencephalic nucleus, and motor nucleus. The sensory nucleus gives sensory nerve. Motor nucleus gives motor root to the muscles. Now functional components. GSA, general somatic afferent. These gives fibers to the ophthalmic division, which is completely sensory division of trigeminal nerve. General somatic afferent for maxillary division. It is also a sensory division. General visceral efferent and general somatic afferent for mandibular division. It is mixed nerve. SVE component gives motor fiber and GSA component gives sensory fiber to the mandibular division. Now trigeminal nuclei. These are the nuclei for trigeminal nerve and they are present in the pons and medulla oblongata. Mesencephalic nucleus, this is spinal nucleus, this is the principal nucleus which is sensory nucleus, and this is the motor nucleus. The sensory nuclei gives large sensory root and the motor nucleus gives small motor root. The large sensory root expands to form a sensory ganglion called trigeminal ganglion. This is trigeminal ganglion. It lies on the petrous part of temporal bone. It gives three divisions: ophthalmic, maxillary, and mandibular. The first division and second, ophthalmic and maxillary, passes through the lateral wall of cavernous sinus. After emerging through the cavernous sinus, ophthalmic division. Now ophthalmic division. Ophthalmic division gives branches. The first branch is tentorial branch, and tentorial branch gives fiber to the tentorium cerebelli. These are the tentorial branches. Now the ophthalmic division goes forward. After passing through the superior orbital fissure, it gives three main sensory branches. First is the lacrimal nerve, then frontal nerve, the third is the nasociliary nerve. Now the frontal nerve. Frontal nerve gives sensory branches to the front forehead, scalp. This is lacrimal nerve, which gives branches to the lacrimal gland, skin of eyelid, and conjunctiva. Now the nasociliary nerve. Nasociliary nerve gives branches which are short ciliary nerve and long ciliary nerve. These are branches secretomotor and vasomotor for sphincter and dilator pupillae muscles. This is the external nasal branch, which is the branch of nasociliary nerve, which supplies the skin of external nose, skin of nose. Now this is the distribution of ophthalmic nerve. The first branch is lacrimal nerve, which gives further branches to lacrimal gland, skin of eye. This branch is skin for eyelid and conjunctiva. The frontal nerve gives branches which are supraorbital branch and supratrochlear branch. Supraorbital branch gives further branches to the mucosa of frontal sinus, skin and conjunctiva of middle of superior eyelid, and pericardium and scalp to the vertex. And this is the supratrochlear nerve. It gives branches to the skin and conjunctiva of medial aspect of superior eyelid, and second and pericranium of anteromedial forehead. Now this is the nasociliary nerve. Nasociliary nerve gives branches which are short ciliary nerve and long ciliary nerve. These are sympathetic branches passing through ciliary ganglion, and these sympathetic branches are for sphincter and dilator pupillae muscle. Nasociliary nerve also gives branch which is infratrochlear nerve. Infratrochlear nerve gives anterior ethmoidal nerve, which gives further external nasal. External nasal nerve gives branches to the cutaneous branches for the skin of nose.